Hello, everyone. Thank you for joining us today on our second part of Keeping Up with COVID Therapeutics. And this session is going to focus on oral antivirals. The first one we'll talk about is Paxalvid, which is maltrelvir and ritonavir. And this therapeutic is for the treatment of mild to moderate disease in adults and pediatrics. And these are 12 years and older, at least 40 kilograms with a positive COVID-19 test. Paxalvid is recommended for those who are at high risk for severe disease progression, so this meaning hospitalization or death. It is not used in patients who are hospitalized with severe infection. And as far as the packaging for Paxalvid, it gets a little bit complicated because there are the two products and there is a dose adjustment for renal impairment. So the packaging of Paxalvid comes with 150 milligrams of the maltrelvir and then 100 milligram tablets of ritonavir. So the normal dose would be, with no renal impairment, the normal dose would be 300 milligrams of maltrelvir plus 100 milligrams of the ritonavir twice a day for 5 days. It doesn't matter if you take it with or without food. You want to make sure that you initiate it as soon as possible, but within 5 days of symptom onset. So that symptom onset is very important. You want to make sure you have accurate information from your patients, initiated 5 days before symptom onset. So with renal impairment, there is a little bit of adjustment. So instead of 300 milligrams, it's only 150 milligrams of the maltrelvir plus 100 milligrams of the ritonavir. So the ritonavir portion does not change, and that is still twice a day. So when you're prescribing these to patients, you want to make sure that on your prescriptions, you specify the numeric dose of each active ingredient. So, you can't just write Paxalvid. You have to specify the milligrams that's being prescribed. Also, what's important about pharmacists is you want to alter the blister pack because it does come already packaged. So for those who are renally impaired, you'll have to take out one of the tablets of the maltrelvir. And so you want to make sure that the patients know that the pharmacists are doing that so that they don't get the blister pack and think, that their product has been messed with. And some of the warnings and precautions, there are a lot of drug interactions with Paxalvid, specifically with the CYP3A. So you might want to just go ahead and run a drug interaction checker for anyone who is being prescribed this Paxalvid. You also want to use caution for those who have pre-existing liver conditions. So for example, clinical hepatitis or jaundice because of the ritonavir portion of that. You also run into the risk of developing resistance with HIV protease inhibitors if you have someone with uncontrolled HIV-1 or someone with undiagnosed HIV-1. In regards to pregnancy and lactation, there really is not that much data, either unavailable or insufficient data, as with a lot of these new products. That's not surprising there. So just use caution in those patients. For the molnupiravir, which is our second oral antiviral, this is also for the treatment of mild to moderate disease in adults. So adults only for molnupiravir, so 18 years and older, with a positive COVID-19 result. This is also for those who are at high risk for severe disease progression, again, those who have a high risk of hospitalization or even death from COVID-19. It's not for use in patients who are already hospitalized with severe infection. Now, the dose for molnupiravir is a lot more simple. It's only 800 milligrams twice a day for 5 days. Again, no regards to food, with or without. This one as well, you want to initiate as soon as possible, but within 5 days of symptom onset. Some of the warnings and precautions, unlike the Paxalvid, there's no expectation that it will have any effect on renal or hepatic impairment, so you should be good to go there. There is a black box warning, however, for pregnancy. So based off of animal reproduction studies, there has been shown that there could potentially be fetal harm to the baby. So definitely want to weigh the risk and benefits, since obviously there are a lot of risks associated for those who are pregnant and left untreated with COVID-19. So it is very important to weigh those risks and benefits. The reason it's not authorized for patients under 18 years old is because there is a high likelihood of effects for bone and cartilage growth. There hasn't been any data on lactation, so you might want to just consider alternatives for breastfeeding. And again, there are implementations in practice that have been attached to the document that are attached to this video. So we go through the treatment locator tool. It takes you to the VDH website where you can view all the information and guidance documents that VDH has put out on these therapeutics. You'll also find Paxalvid and molnupiravir fact sheets for healthcare providers. And you can always reach out to us at our provider support email, which is COVID-19 Therapeutics at vdh.virginia.gov. And that email will be on the document attached to the video as well. Thank you for watching.